All right. Well, welcome to part two of the podcast on this kind of practice for the model pharmacy exam as it relates to the drug information and the processing of prescriptions that don't have any errors. Part one of this podcast dealt with going through the packet of 6 prescriptions and identifying which one of those had prescription errors and which ones have not. So, what we're starting with at this point is the fact that we've identified 2 prescriptions out of our packet. The first of which is one here for Sylvia Jones for her Lipitor 10 milligram tablets. There are no dosing errors, there's no contraindications from her profile, and it doesn't interact with her other medications. So we are ready to fill this prescription. So let's go ahead and pick up with processing and typing the label for this prescription. So I'm starting back over here on the left with the lab website. So I'm going to click on dispensing lab functions, the prescription drop-off window, and then click on this pharmacy dispensing software simulator. All right. So this is now we're ready to type our label. So the first set of information it wants is about the patient. This is going to be through a drop down, so it's relatively simple. The only thing I will warn you about is no different than real practice, is that it's real easy to pull. Oh, wait a minute. I wanted Sylvia F. Jones, but I accidentally pulled up William P. Jones. That would be a mistake. So just make sure that you take a minute that once you've selected it, that you make sure that you have the correct patients. So it will do a couple of things. It will put the patient's name in this field for you. It will also pull up this patient's profile information, which is a quick way that if you hadn't already, which you should have, but if you hadn't pulled in the documentation for the demographics and profile information, it shows up here as well. This is also where you can indicate whether or not the patient does want safety caps, and if this says yes, and down here it says yes, so we know that information is right. And then lastly, this is where we're going to want to indicate whether it's cash or third party. If it's third party, you'll notice if you change that, you have a lot of other additional information, other fields to fill in. But since this patient is paying cash, right here as indicated over here, where does it say? Cash, then we don't have to, oh, I'm sorry, right up here. Here's cash. So we don't have any third party information. So at this point, what we have done is entered the information for the patient, and I think we're ready to move on. Let's move on to the prescriber. Again, relatively easy. In this case, where is it? Where is it? Oh, there it is, Dr. James T. Warren, right there. So that's the prescriber we need to select. So come down here. There's fewer prescribers. We'll pull that up. It does indicate that we've selected the right name. And here's some important information about the doctor. This has their practice name, their address, telephone number, DEA number, and their provider number, their national provider number. So, I thought we had to have controlled substance. Do we need the DEA number on the prescription? We do if it's a controlled substance, but not if it's not a controlled substance. So I will show you here in a little bit where you can find that information, and we might need to add the DEA number on there if it's a controlled substance. We'd also need to add the patient's address, but so let's come back to that. We'll come back and see if it's a controlled substance later. Okay, so having said that, let's now talk about the drug because we got to know some information about it. Now, the way this is set up is very important. The first thing I ask you about the drug is not the drug name. I ask you for the pharmacy DAW code. That stands for the dispense as written code. If you click on that, what you can see is that in most pharmacies, and certainly for lab, the main codes that you are going to use for most of the prescriptions you fill for me will either be a 0 or a 1. Okay, between these two numbers, the 0 and a 1, we're going to focus on these. I think it's easiest to make sure that you learn what a number 1 means. It's the easiest one. You put a DAW code of 1 when the prescriber indicates that substitution is not permitted. That is, give the brand only. You may not give a generic. If the doctor says, do not give a generic, brand only, no substitution, any of that verbiage, then you're going to select number 1, which says substitution not allowed by the prescriber. Okay, so let's see, does that apply to this prescription? Where, and again, the different prescriptions indicate this a different way. You really have to take each prescription and look carefully to see where the doctor indicated whether or not you can give a generic. Well, right here on this prescription, it says DAW, dispense as written, it says substitution permitted. So in this case, the doctor is clearly indicating to us that we can dispense a generic. So clearly it's not going to be a number 1, which is substitution not permitted, because here we have substitution permitted, so it's not a 1. So what is it going to be? Well, let's look here under number 0. That is going to be a product number 0. 0 means that no product selection indicated, meaning that you do not have to give a specific company. The doctor did not say only give this brand, this particular manufacturer's version. You can substitute. As long as it's an AB rated generic, then you can substitute. So essentially the doctor indicated, the prescriber said no product selection. We're not saying the drug. The doctor indicated the drug and the strength and the dosage form, but not the specific manufactured version of it. So that's why we're going to choose a 0. So remember this. You give a 1 as a DAW code. Give a 1 when the doctor says do not substitute, brand only. If the doctor doesn't say anything about having to only give the brand, if they say substitution permitted, generic okay, then you're going to use a DAW of 0. Okay? The only reason that this is a little bit confusing about the 0 is that there are times, let's just say there wasn't a generic for Lipitor. Now there is a generic, so we can do a 0 for a substitute. But let's just say Lipitor did not come as a generic, but the doctor says substitution permitted. So it's not like the doctor said we couldn't substitute, so number 1 wouldn't work in that sense, okay? This could never be a number 1 because the doctor said substitution permitted. So if the doctor did not specifically say brand only, you give a 0. So it turns out you will use a 0 when you do perform generic substitution, and you will also use a 0 when you dispense the brand, but only because there is no generic available in the marketplace. It's just not available. It's not like the doctor indicated it. The only time to give a 1 is when the doctor actually indicates to not substitute. Otherwise, it'll be a 0. All right. Now, there you'll notice, and I'm not going to spend the time to go through all of these permutations. Hopefully, you'll cover that in law. There's all sorts of variations. The only other kind of one that you'll see in practice more frequently is a number 2. A DAW code of number 2 occurs when the doctor said, Lipitor 10 milligram, give the generic, substitution is just fine. But the patient turns to you and say, I don't care what the doctor says. I do not want the generic. I don't think generics work as well. I want the brand name Lipitor. In that case, that's fine. You don't have to contact the prescriber or anything. The doctor, you don't have to substitute, but who's making that decision? So a number 2 says patient requested. So in that case, you would run it through for Lipitor, but you would put a DAW code of 2 on that situation. And who's going to pay the difference there is not the insurance company. It's going to be the patient because it's the patient who requested it. So again, that's out of all of these other ones, the ones that you'll still see because there are a lot of times patients might request that. Getting back on track. You'll notice I put these 2 lines here to separate the 0 and the 1 from all the rest of these. Why? Because most of the time it's either a 1 because the doctor said do not substitute, or it's a 0 because the doctor says substitution is just fine. So in this case, it's a 0. Finally, good. But that's important. Coming back, I make you make that decision first before you type in the drug names. Okay, see where I'm about ready to type in the drug name. Problem is, my computer system does not think for you, so it will only help you fill in the drug that you're looking for. So let me ask you at this point, the drug that we're going to dispense to the patient, is it Lipitor or is it generic Lipitor? Is there a generic available? So remember, the doctor said substitution permitted. So if it's permitted, you will always absolutely attempt to dispense a generic if a generic's available. Well, let's say you don't even know what the generic name is. You cannot type in Lipitor yet because you're either dispensing Lipitor if there's no generic, or the generic form of Lipitor if it's available. So now I'm going to come over to my drug information resource. So let's go back to LexiComp. I would pull up my LexiComp drug information, which is the one we use for this exam, and type in Lipitor. And I pull up Lipitor. All right. Now, there it gives me the generic name. So I know the generic name for Lipitor is atorvastatin, but that doesn't mean necessarily, because all drugs have a generic name, that doesn't mean a generic product's available. So another big thing that we want you to start learning is this section here under preparations. So I'm going to click under preparations and look over here under dosage forms US and see if there's a generic available. And absolutely under tablets, oral, it says here's the Lipitor brand coming comes in these strengths, but it says there is a generic available with those strengths. And since the doctor has prescribed 10 milligram Lipitor's substitution permitted, what am I going to dispense? I'm going to dispense atorvastatin 10 milligrams. So I am going to dispense the generic because there's a generic available. So now I can come back to here and start typing in. But my computer does. Notice as I start to type it, it will try to guess what you want. However, it will not do the substitution for you. So if you don't know that the generic for Lipitor is atorvastatin, it's not going to remind you of that. So I started to type in Lipitor and all I get is Lipitor. So that's not right because we know it comes as a generic. So what was the name of the generic? It was atorvastatin, A-T-O-R-V-A. Now those are the generic forms that are available and the strength I want, so I can come down here and touch or click on 10 milligram tablets. Take a minute. Atorvastatin 10 milligram tablet, is that what the doctor wants? The doctor wants generic substituted Lipitor 10 milligram tablets, and the generic for that is atorvastatin. Good enough? So that's where we're at. Now, this is where I need you to use your imagination just a little bit because what you need to do is come up with a manufacturer and a cost and an NDC number for a specific product. And now, in a pharmacy, you would go get that information from the actual bottle you're going to dispense. Now, in lab, we don't actually have those products for you to dispense. We want you to use this as an opportunity to use your drug information skills. So what I mean is you're going to come back to LexiComp and right over here under preparations, remember I clicked on preparations, US dosage forms, look right here. There's a section called images. I want you to come under images because now what you can see is that it will try to list out, and it sometimes has pictures, sometimes it doesn't have pictures, but what I want you to do is come down and find any commercial product that matches what you want to dispense. And again, you can go down and find anything that you want, okay, that matches this. So let's just say this. I want a atorvastatin 10 milligram tablet. Here's atorvastatin, not 20, that would be wrong, but here's Dr. Reddy's, because I just love that name, Dr. Reddy's Lab 10 milligram tablet. That would be just fine. So what I'm going to do is click on it. And what I get right here is an NDC number. Now, sometimes it may have more than one NDC number. That's just going to differ by package size, so I don't care about that. So let's just say if this is right, let's double check that it's an atorvastatin 10 milligram tablet. That's what I want. So I'm going to select and use this NDC number to begin with. I'm going to come back over to here and I'm going to put that in the NDC number. Now, here's the problem though. You'll notice NDC numbers are 5 digits with a dash, 4 digits with a dash, 2 digits. So when I put this in here, I'm going to have to go back and I do on the exam make sure that you type it in the right format. So 1, 2, 3, 4, put a dash in there and make sure you put the NDC number in essentially 5 digits, 4 digits, dash 2 digits. So that's the right NDC number. Now I can come back here and this is from Dr. Reddy's Lab and you can abbreviate things here a little bit. So that's the manufacturer. So hopefully you saw that I found a actual commercial product with this NDC number from this manufacturer for this drug. The only thing missing is cost per unit. Okay, and unfortunately, you can't get that in this information right here. So what I'm going to do is just go back to the monograph, click link there, make sure I come back here to preparations because you may not have noticed below here we were at here for dosage forms, come down, it has pricing, or you can click right here on pricing, it puts it to the top. Now, in this case, in the US, for let's see, this is atorvastatin, this is Lipitor. Don't confuse those. Brand name product, it has this price. Generic products range for the 10 milligram tablet anywhere from $385 to $750. Okay? So what I'll have you do is just choose the lower number. So whatever the lower number is, in this case $3.85, is what I'm going to choose to put there. Okay? So you're going to look up all of that information. So now is where you need to also decide whether or not it's a controlled substance or not. And so if I click back here under images, once again, is where you could see right here where it says RX/OTC. it says RX. If it was a controlled substance, it would give you the controlled substance rating there. And we'll see that on the next prescription. It would indicate it at that point. So it's important to know whether it's a controlled substance. It impacts your documentation and some of your auxiliary labels, but this is not a controlled substance. So I can go back to the monograph and I have that information correct. It's not a controlled substance. Okay? That's everything we needed to do to indicate the drug. All right. So now SIG, instructions for the patients. All right. This is very important. When you type this in, there are no shortcut codes. You have to type it as a complete sentence. And you'll notice it says right here, note, start with a capital letter, end with a period, and do not use all caps. It's a sentence. So this is an important part for practicing your interpretation, because right here under SIG, it says I, which stands for what? One. PO, which stands for by mouth. QD, which stands for once daily, and then for high cholesterol. What you cannot type in is just one by mouth, once daily for high cholesterol. No, we're going to have you, and we'll practice this in lab. We want you to use your good SIG technique. So, and just for the short part, the way that I'd want this particular SIG to be typed would be to start with a capital letter, and you start with the verb take. Preferably then numbers, since patients understand numbers from a health literacy standpoint better. Take one, and then what is the dosage form? Tablet. Okay. Now, what are they going to do with the tablet? They're going to do it by mouth. Take one tablet by mouth. And in this case, we don't just say daily. It needs to be once daily, or you can do either of those. But in this case, I will do once. And don't stop there, because the doctor did indicate what it was for. It was for high cholesterol, period. Okay? Take one tablet by mouth once daily for high cholesterol. All right, there you have it. Make sure you get it right. All right, now we're ready to move on to quantity and refills. All right, so now let's look over here. The doctor indicated to dispense 30 and with 4 additional refills. Easy enough. I'll say per amount prescribed is 30, and I'll hit the tab button, and you'll notice it automatically puts in the quantity to dispense. And most of the time, what's prescribed is the actual amount to dispense. But understand there are unfortunately other situations where, due to insurance or maybe controlled substance restrictions, there are times where you cannot dispense what was actually prescribed. Now, the patient may still be entitled to that difference, but they can't just pick it up at this time, either because the insurance only pays for a 1-month supply instead of a 3-month supply, or controlled substances, you can only get so many days at a time, things like that. So there are occasions where the prescribed quantity can be different than the quantity that you actually have to dispense. Okay, this case we are going to, unless there's some specific reason in lab, and that's probably not going to happen for this exam, but to understand that most of the time whatever you're going to be prescribed is what you're going to dispense. Now this is interesting. It says day supply. Where on the prescription does it say the day supply? It doesn't. You actually have to calculate this. It's usually not too difficult. What you're going to do is take the number to be dispensed and divide it by how many dosage forms they're taking per day. In this case, they're taking 1 daily. So again, if we take 30 divided by 1 per day, that means it's a 30-day supply. If, for just example, we were taking 30 and the instructions were to take 1 tablet by mouth twice a day, it would be 30 tablets divided by 2 tablets per day, which would be a 15-day supply. I know you're rolling your eyes at me at this point, but it is important that you carefully calculate the day supply. There are lots of variations with things like medications taken as needed. PRN, meaning maybe not 4 times a day, it's just 4 times a day if needed, and variations for like eye drops and ear drops and things like that. So it's beyond what I want to spend the time on now to go through that, but it is very important, especially for third-party prescriptions, that you correctly indicate a day supply for the product being dispensed. All right, lastly is refills, and as we said, the doctor indicated 4 additional refills, so it's important that we put the 4 refills there. All right. Now let's talk about the dates. All right. The program will automatically put the date in as today for the date dispensed. We assume that you are filling this prescription today, so that's why it'll automatically fill that in. What's important though is the date the prescription is written. Are prescriptions always filled the day they're written? No. How long are prescriptions good for? Well, if it's not a controlled substance, it's good for a year. If it's a controlled substance, it's only good for 6 months. Either way, the patient has a certain amount of time to fill a prescription while it's still valid. So what's important is to look over on the prescription to indicate where it was. So right here, the doctor here, it was written, the date this prescription came in was September 1st of, and again, I always put XX for years so I can reuse these for multiple years. So you can always assume the XX stands for this current year. So this was prescribed on September 1st of the current year. So what I would come over here is whatever year this is, I'm going to type in the day, the month, and the day, and whatever the current year is. And as you can tell by the date to dispensed, it's 2019. Now, date the prescription expires. This is important. This is about prescription expires because remember the patient has 4 refills, but the patient can only get that prescription refilled for as long as the prescription is valid. And we said for a non-controlled substance like Lipitor, it's good for a year. So in this case, the prescription, these refills can only be filled up until 9/1 of 2019. Okay, and here I just realized that my date here is a little funky for my prescription. So we're going to assume that today is September 12th. Sorry about that. It is September 12th, and we're getting a prescription that was written by the doctor on September 1st. Why? I'm sorry for the weirdness. Trying to say that what's important is to remember the prescription expires 1 year from the what? From the date it was written. Make sure that these two go together. In this case, since it's a non-controlled substance, it's 1 year from the date it was written. Not 1 year from the date it was dispensed, but from the date it was written. Okay? Don't get that confused with the use by date because the BUD or the beyond use date or the use by date is not the date the prescription expires, it's the date the pills expire. Whatever it is you're dispensing, the cream, the inhaler, the whatever it is, the thing you are dispensing to the patient, you're telling them here it needs to be consumed by or used by a certain date. Okay, this essentially means the same thing as the expiration date on the bottle of the pills that you're counting out. However, since you don't have that bottle of pills with you, you don't know what that is unless you go back and get it. Well, we're kind of lazy in pharmacy and we don't want to have to go get that every time. So here's a quick answer. The beyond use date for most commercial products, tablets, capsules, creams, ointments, liquids, things that you dispense that are come pre-made. You don't have to reconstitute them. They come in that form. We assume a 1 year beyond use date. So the short answer is what you're going to do is put 1 year from when though? 1 year from the date it was dispensed. So since we're dispensing this on September 12th of 2019, you're going to want to consume this product in no longer than 9/12 of 2020. All right. And the reason we can get away with that is that most commercial products are good for at least 2 to 3 years. So 1 year is a conservative estimate. But it also says that while you're actually filling this prescription, you always need to check the actual expiration date and make sure it isn't shorter than this. Because if the actual expiration date of the commercial product was less than your 1 year that you put on the label, you'd have to change the label. But this is kind of just a cheating way to be able to quickly assign a date that's probably less than the real expiration date but probably a lot more than the amount of that you're dispensing. Since most of the time in pharmacy we dispense a 1 month or a 3 month or even a 6 month supply, we almost never dispense more than a 1 year supply. So that's why this is usually a safe date to put. Okay. Lastly, let's say, well, not lastly, but keep going. Delivery status is on our form here. The patient will be waiting for it. So let's indicate that the patient is waiting. Okay. And again, it will automatically just put in essentially a date that's about an hour ahead of when you're actually dispensing this. So you shouldn't have to mess with the due date and time. But basically, that's when we would say that the prescription needs to be ready by. All right, let's keep going. We're getting closer. Documentation. Well, we need our initials. So whatever your initials are, you would put your initials in here, and this will be the pharmacist initials. Now, this is important. The origin code. We haven't talked about this. The prescription origin code, you have to look on the prescription, and it's one of 4 things. So I'll drop that down. So look over here and compare it to the drop-down list. The prescriptions, the origin code refers to how did this prescription get to the pharmacy? Is it a handwritten prescription that the doctor wrote by hand, gave to the patient to present to the pharmacy? Is it a written prescription? Or is it a telephone prescription? Is it one that was called in to the pharmacy by the doctor or somebody from the doctor's office, called it in verbally over the telephone? Or was it one that was sent electronically? Now, the doctors oftentimes will, with computerized order entry, they will just essentially electronically send it via the internet to the pharmacy. So there's electronic. Not to be confused with number 4 here, which is facsimile, a fax. And while fax is an electronic form of communication, it's considered separately because it goes through the telephone line. So remember, let me show you some examples here. So if I just kind of scroll around on the left, a written prescription, let's see, where's a written prescription? Ah, right here. You'll notice this prescription right here, it doesn't indicate that it's electronic, telephone, or a fax. This is what the written prescriptions look like in lab. Not to be confused with, let me go back up here. I thought I saw, here we go. Look right here. This says telephone prescription, and it has somebody calling it in by. So that is a telephone prescription. Oh, what does this say right here? This says it's a fax prescription right here. Fax prescription. So that would be a number 4. And the one we were doing, coming back up here for Sylvia Jones's Lipitor, we'll notice that it says electronic prescription. So this one came electronically. So again, between those, if I look here, if it was a written, it's a number 1. A telephone is number 2. Electronic like this one is number 3. Or if it's a fax, it's number 4. In the lab here, you can unlikely to use a number 5. 5 will occur when it's a transfer from one pharmacy to another. That is, it's coming into this pharmacy because we transferred it from somewhere else. Or there are sometimes where a pharmacist can actually prescribe medications. There's a state protocol, for example, for naloxone to deal with opiate overdoses. So if the prescription is because you, the pharmacist, are prescribing it for your patient, but under that protocol, you would run it under a origin code of 5. But our patient, we said this is an electronic prescription. Okay, serial number is the prescription number. The computer will put that on automatically for you. It also will do a dispensing fee automatically of $5. So that rest of that will be filled in for you. All right, we're coming down to some important information as it relates to the auxiliary stickers. All right, so on the exam, these are the auxiliary stickers that you have to ensure you put on if they are needed. Okay, so if they are needed, then you have to add these. So let's look at these kind of quickly, just get this a feel. It says controlled substance required statements. So if this was a controlled substance, you could put that statement under any one of the 4 possible auxiliary stickers. We said this one's not a controlled substance, so we don't need to worry about it. Well, the next one is medication guide. Certain medications by law, FDA requires that a specific information called a medication guide be provided. So that's part of what I want you to make sure and know whether or not that's required. So in LexiComp, you would know if it's required or not because it would come over here and say specifically a medication guide, okay? Or vaccine information statement is the way it's listed. So let me show you that because atorvastatin doesn't. But if I quickly kind of pull up, let's type in Levaquin. Levaquin. So if I fill in that drug and pull it up, you'll notice right here it says medication guide and or vaccine statement information right here. So do you see where it says medication guide? Medication guide. If it has that right there in the monograph right here for the drug, then you would add the sticker that says a medication guide will be dispensed. Okay. Now going back to, if I kind of quickly try to go back to the drug we're actually doing, atorvastatin, you'll notice there is nothing here about medication guide. So when I come down to here, I do not need to add the sticker for medication guide. You'll notice these two kind of go together. It's either take with food or take on an empty stomach. And now, if it doesn't matter, it's not a sticker. If it matters, that is, you have to take it with food, you need to add the sticker. If it has to be on an empty stomach, you need to add that sticker as well. All right. And here's one that says do not crush or chew. That's also information that's primarily if it's a controlled release or an extended release dosage form. Most of those, it's very important that you don't crush or chew it or it will no longer be an extended release. And if you look here, there's one that we put on a lot of antibiotics because most antibiotics need to be taken the complete course. We don't want to stop taking them quickly, so we'd want to finish all that medication. Here's one that says shake well. If it's a suspension, whether it's an eye drop, an oral medication, if it's a medication, a liquid medication that has to be shaken up to be reconstituted or to be mixed before you use it, we want to shake well. And then if it has to be kept in the refrigerator, we want to make sure that we tell the patient to keep it in the refrigerator. If it needs to be kept at room temperature, we don't need a sticker. Most patients will know to keep it at room temperature, but if it has to be refrigerated, we want to warn them. And then lastly, there are a lot of medications that cause sleepiness or drowsiness, and that alcohol can make that a lot worse. And to be honest with you, almost all of your pain medications, for example, all the opiates, things that you take, the Percocets or oxycodone, hydrocodones, codeines, all of those cause drowsiness, and alcohol makes it worse. So there's many drugs where that's an important sticker to use as well. So let's kind of focus on that. We know that the first two don't apply to our drug. We don't know anything about the take with food or anything. So let's come back to Lexicon. We're under atorvastatin. You'll notice there are links right over here that says adult patient education. So I'm going to click on that. Now if I scroll, you can see the different sections. Now, I don't want to spend time to do this. You'll have to practice this in lab. But one of the sections you go through, there are side effects and things. But let's go down here. It says, how is this drug best taken? Take this at the same time. It says, take with or without food. So right here, this tells me I don't have to take it on an empty stomach. I don't have to take it with food. So I'm not going to indicate one or the other with that. Okay. This is also where it would probably indicate to do not crush or chew. One thing is looking through this information, I can tell it's not an extended release tablet, so that's not something that I need to worry about. Okay, now, so between looking at this section here about how is this drug best taken, let's look down here under storage. How do I store this medication? It says store at room temperature, so I don't need to refrigerate it. It's not a liquid that has to be shaken. It's a tablet, so I'm not going to have to shake that. Another thing, just for the sake of time, that's a good say is what are some things I need to know? This is a good section because, again, one thing it says right here is grapefruit juice. It does say grapefruit juice is something that you need to possibly warn your doctor about, but it does say right here, avoid or limit drinking alcohol to less than 3 drinks per day. Drinking too much alcohol can raise your chance of liver disease. Well, that's an interesting one. So I'm trying to go back to here. So I would argue that it's not an alcohol drowsiness thing. So there are none of these required stickers that you have to put on for a Lipitor prescription. Okay, so right now you really could just submit it without any additional information. But we did a good one where maybe we want to say avoid alcohol. That's very different than alcohol makes you drowsy. So you don't have to just use these. For any one of these 4 list stickers, you can come over here. So I'm going to do this for open auxiliary label number 1. Okay, and here's a whole bunch of different stickers that you can actually apply to your prescription bottle. Okay, and you spend some time kind of looking through to see that the ones that are on there. What I want to do is find one that says avoid alcohol. So I know that one's up here near the top. It says right here, do not drink alcoholic beverages while taking this medication. So all I need to do for this is click on it. It gives me a warning that says it's been selected and to hit OK. So I'll hit OK. If I come back to here, nothing happened because you have to still click on this load. So once you've opened it and you've selected it, click load. It'll put the number in here for you and you can see a little preview of the sticker it's added. So this is just to show you where I have manually added one of those auxiliary stickers. Okay, so the one other thing that you can do is it has another blank that says custom patient information. So this isn't a sticker necessarily or a label, but it allows you to type in one sentence. Now I don't want you to copy and paste 20 things in here. So this allows you to type in one sentence. So maybe what you would do something like this: avoid grapefruit juice. Okay, maybe that's something else that we don't have a sticker for and that you want to add in a simple statement. Well, that's pretty much it. Once we've done that, then you can come down here and click on this button down here that says click to generate completed label. And this is what all of that work was to do. Okay, now let's just say you clicked on that and you say, oh no, I've made a mistake here. That's okay. What you would do is you just close that tab. It opens up as a new tab. The other tab has all of your information in it still, so you can make whatever changes you want. Come back and re-click on the button again. But what it generates, the whole point of this is you can see the label that it would put on to the actual bottle. It puts the auxiliary stickers that you indicate over here. Below here is your insurance information, including the DAW code, origin codes, NDCs, costs, things like that. This is the prescription documentation, the little sticker that gets attached to the prescription, which includes the fill date, your initials, and so forth. You can see that information here. And these are just some other information that it populates for realism. So anyways, that is what you've done. So if you're happy with that, you would print off a hard copy, and that's what you're going to include with your prescription. All right, so I'm going to close that one, and I am going to go back up to the top, and let me refresh this to kind of clear it all off. And let's do one last prescription. I will do this much more quickly because even I'm tired of listening to myself. But I wanted you to kind of see this process. So going back to the packet here, there was one other prescription that we had that we could fill, which was for Alice Sawyer for the new Cinta. So I will try to do this quickly. So let's fill this prescription. So this one is for Alice Sawyer. So come down here and choose the right patient. Everything is okay. This is correct. Now I can ready to go with admin. I want to show you that once you get used to this, you can actually fill these prescriptions relatively quickly. Okay, now I'm ready for the drug. It says do not substitute, so I know that that's going to be a DAW of 1. Okay, so I'm not going to substitute. I'm going to actually fill the new Cinta, so I can just start typing new Cinta, and it's the 50 milligram tablet. I still need to look up this information here, so let me come back to Lexicomp. Now I finally need to type it in, new Cinta, pull it up. Now remember, for the product information, I'm going to go down here to preparations. And here we go. There's my new Cinta 50 milligrams. You'll notice here there's not a generic for it, for that specific brand of that. But at this point, what I need is a specific manufacturer. So I'm going to click on images. And here's, make sure that we don't want to confuse new Cinta with new Cinta ER, and we want to make sure we get the right strength tablet. So here's the 50 milligram new Cinta tablet. So I'll click on that. You'll notice there is a lot of NDCs. I'm just going to take the first NDC number I see here and come back over and type it in here. Remember to put my dashes in the right spot. And so I know that's right. I can come back over and get my manufacturer as the manufacturer. So we'll just copy that information there. That's my manufacturer. Come back to Lexicomp and go back to Monograph and find the price under preparations. There's preparations. We said pricing for the regular release tablet, not the ER. We want the regular release for the 50 milligrams is $7.63. So I will put that number in there. And we said that it was a Schedule 2 medications. So there's the C2. So that information is all typed. Now I can type in the SIGs, which is to take 1 tablet by mouth twice a day for nerve pain. Period. Okay. Quantity prescribed is 60. Quantity to dispense is 60. The day supply, again, we have 60 tablets divided by 2 doses per day, which will give me a 30-day supply and no refills. All right. The date dispensing, we're going to say again is actual September. Come here. 9. And so that is today's date we're pretending. It was written on 9/3, so I'm going to come back under date written and say 9-3-2019. The date it expires. Oh, so didn't we say this was 1 year? Be very careful. We said this is a Schedule 2 medications. Prescriptions for C2 or for controlled substance medications expire in 6 months. So not in 1 year. So it's 6 months from the date it was written. So if you think about that, 6 months to 9/3 is going to be March. So it's going to be 3-3-2019. So that's when the prescription expires. We need to use it by 1 year from the date of dispensing. So remember, the prescription expires in 6 months, but the actual pill, the product, just because it's a controlled substance doesn't mean the pill expires or shouldn't be used within a year. So we still use 1 year for the beyond use date, but 6 months for the prescription expiring for a controlled substance. All right, delivery status we can see is still waiting, so I'll select waiting for that. And type in my initials. the origin code here. This is a written prescription, so for a written prescription, we'd call it a 1. This information is pulled in for us. Now, we said this is a controlled substance, Schedule 2, so we have to add the controlled substance label, so I'll put that into number 1. Okay, let's see if it requires a med guide, and let's see, especially for this, if it requires drowsiness. So let's see here. One thing here, let's look under the med guide. Does it require a medication? Oh, right here, it says medication guide. So I know I need to add a med guide. So I'm going to come over here and say, let's add the med guide to number 2. So I need a controlled substance. I need a med guide. Now we can actually click on the adult patient education. And let's scroll down here and let's see what it says about how do I take this medication. So it says, how is this drug base taken? Okay, so these are the regular release tablets. It says all tablets take with or without food. Take with food if stomach upset. So that basically means I don't have to worry about that. If this was an extended release tablet, if it was the new sent to ER, you can see right here where it says swallow whole, do not chew or crush. So that's where that one would come in, but it doesn't apply to our specific form since it's not the extended release. So I don't have to worry about that. So let's come up under other side effects here and see if it says anything about being tired. It says feeling sleepy, dizziness. And again, I'm not taking the time to show you exactly where, but again, alcohol can potentiate those effects. So what you would want to do is come over here and also add this drowsiness alcohol potentiates to number 3. So out of all of these, and again, I can come back here quickly and show you the storage. That's an easy one. How do I store this? Stored room temperature. So once again, you don't need to worry about refrigeration. So that's kind of showing you a quick way of being able to identify the correct auxiliary stickers for that one. So having completed all of that, I can see that that information and generate my label, double check everything, and that's how you would quickly kind of process a prescription. You can see that once you get used to the system, it doesn't need to take a lot of time. It's knowing really where to find the information you do need in LexiComp in a quick, efficient way. Before ending, though, there's something very important. We have put all of the information we need to document into the computer system. What we have not done is put all of the information that's required by law to be on the prescription, because this is a controlled substance. So what we need to do, and I'm going to come back to my label part here and come back up to the top, what has to be added onto the prescription, on the face of the prescription for a controlled substance, includes the patient's address. We can see right here that the patient's address, and we've already written it down on the side, is 1337 Lyons. Now, in the real world, you would include a city and a zip code and all of that, but for now, for us in lab, that's all we need to do. Now, you would say to yourself, well, it's written over here. Does writing it over here count for putting it on the face of the prescription? The answer is no. The law says that this information has to be on the face of the prescription. So we're going to add it right there. The other thing we need is patient address. We need the doctor's address, which is here, but we also need the doctor's DEA number. So that's where, looking over here, you can see that the DEA number for Dr. Abman is BA 4132647. And so we've now added that information on the face of the prescription, and that does it legally. Now, what you could also do is, what a lot of pharmacies will do is they will actually circle or make some notation when they actually fill this that they double counted it, maybe something like DC, or sometimes people will put their initials in the actual next to adjacent to the quantity. No, I changed my thing there. Change it just so that you can indicate that you double counted it, just in case there's any questions about that. Anyway, so I'm just trying to finish up on the fact that once you've generated the label, this is great that you've typed and generated this label and completed all of this and printed it out for the exam. But for the controlled substance prescription, do not forget to also include documentation on the face of the prescription that is required. Okay? Well, hopefully this was helpful. I don't think this is a difficult process. It just takes some practice, and hopefully we'll give you a lot of opportunity to do that in lab. So thank you for listening.